Assalamu alaikum. Hello. Have you ever thought about cardiac stress testing? Well, today I would like to explore you on that aspect. Okay, start with this cardiac stress test. In here, there is exercise stress testing. In exercise stress testing, there are some factors associated with increased risk of cardiovascular events. What are the clinical variables? Poor exercise capacity, exercise-induced angina at low workload, fail in systolic blood pressure, fall in systolic blood pressure from baseline, and chronotropic incompetence. So these are the clinical variables can happen when you are doing exercise stress testing. Poor exercise capacity, exercise-induced angina at low workload, fall in systolic blood pressure from the baseline, and the chronotopic chronotopic incompetence like force of contraction of the heart incompetence. ECG variability. What are the ECG variability can happen in exercise stress testing? There may be 1 millimeter ST depression, flat or downsloping. There may be ST depression at low workload. There may be ST depression, that means there is a myocardial ischemia. There is ST elevation in leads without QM, ST elevation without QM, ST elevation in leads without QM, because QM actually means the parami, and there may be ventricular arrhythmia. These are the things ECG variability can happen in exercise test testing, and then should undergo coronary angiography to evaluate for revascularization, either stent or bypass. What are the mechanism? What are the type of stress test? It may be exercise CG test. There may be pharmacological test, adenosine, pharmacological test with adenosine or dipyridamole, and dobutamine stressed echocardiography. In ECG stress testing, the heart rate is increased, blood pressure increase. When patients able to reach the target heart rate, how will you calculate the target heart rate? 85% of the 220 minus age. 85% of the 220 minus age. This is the way we can find out the target heart rate. 220 minus age. Like if somebody uh, has 220, if somebody has 100 years, then his target heart rate is 185% of this 120. So best is 85% of the 220 minus age. And who should not do this test? Left bundle branch block, those who are on pacemaker, left bundle branch block, who are on pacemaker, patients unable to reach the target heart rate. Pharmacological stress testing, non-selective adenosine agonist and dilutes coronary artery without target heart rate or blood pressure. It is best for the patient who are unable to do exercise stress testing like left bundle branch block, pacemaker, and patients unable to reach the target heart rate. These people should do pharmacological stress or adenosine or dipyridamole stress testing, and not for reactive airway disease. Patients on dipyridamole, on patient is on dipyridamole or theophylline. Like if somebody has asthma, as it is called vasoconstriction, reactive airway disease, any sort of reactive airway disease, or patient is on dipyridamole theophylline, should not do dipyridamole stress testing. Dobutamine stress testing for those people who has reactive airway disease and patient unable to reach the target heart rate. Dobutamine stress testing beta 1 agonist and heart rate. Beta 1 agonist and increase heart rate with or without blood pressure. Should not do the patient with tachyarrhythmia. If the patient has tachyarrhythmia, they should not do dobutamine stress testing. Medication to or withhold prior to cardiac stress testing. Hold for 48 hours beta blocker, calcium channel blocker, and nitrates B, C, and these are the drugs should be hold for 48 hours. Hold for 48 hours prior to vasodilator stress test, that is tripyramidine. If somebody is on dipyridamole stress test, if he is on dipyridamole, then stop for 48 hours, then do it. Hold for 12 hours prior to vasodilator stress testing caffeine containing food or drink. And patient can continue AC inhibitor, ARB, deoxystatin, and the diuretics. They should just block the beta blocker and rate limiting calcium channel blocker. So, what classes of medication should be hold for 48 hours regarding stress testing? B, C, N. Exception continue these medication in who with known coronary artery disease undergoing. Exception continue those medication in patients who continue and leading to assess efficacy of anti-anginal medication. So this is all about cardiac stress testing. Hope you enjoyed my video.